Om Swastiastu. We are from SGDB1 PSSKPD 2020 second semester. In this occasion, we are going to present our student project entitled Challenges of Patient-Doctor Fiduciary Relationships and Informed Consent Ethical Dilemmas in Handling COVID-19 Patients. Next. Here's our group members. Next. My name is Nindya and I will explain the background. Next. The emergence of the COVID-19 pandemic in Indonesia has affected various sectors of humans' life, especially the health sector. The number of COVID-19 cases has increased significantly since the virus can be transmitted easily. As a result, special management is needed for COVID-19 patients. During this time, the doctors need to keep distance from the patients and wear personal protective equipment to protect themselves from the possibility of being exposed by the virus. These changes affect the patient-doctor fiduciary relationships, which is based on mutual trust. This starts from good communication between doctors and patients, where this has become limited because of the COVID-19 pandemic. Next. In addition, normally the doctor must explain about what will be done to the patient. This is called informed consent. Meanwhile, in handling COVID-19 patients, doctors often have difficulty in communicating with patients when the patient's condition is critical. Doctors also find it difficult to communicate with the patient's family since almost all of hospitals have restricted the number of visitors that allowed to enter the hospital in order to minimize the transmission of COVID-19. Based on the background, we are interested to discuss about the challenges of patient-doctor fiduciary relationships and informed consent ethical dilemmas in handling COVID-19 patients in this student project. That's all from me. Next.
My name is Widya, and I would like to explain about problem formations, purpose, and also benefits. First, problem formations are, first, what is fiduciary relationship? Second, what are dilemmas of ethic in informed consent? Third, what are the challenges of fiduciary relationship and the informed consent ethical dilemma in general? Fourth, how different are the challenges of fiduciary relationship and the informed consent ethical dilemma in handling COVID-19 patients? And fifth, what are the solutions for the challenges of patient-doctor fiduciary relationships and informed consent ethical dilemmas in handling COVID-19 patients? Next. Purpose are first, to give information about fiduciary relationship. Second, to give information about dilemmas of ethic in informed consent. Third, to describe the challenges of fiduciary relationship and the informed consent ethical dilemma in general. Fourth, to describe the different challenges of fiduciary relationship and the informed consent ethical dilemma in handling COVID-19 patients. And fifth, to offer solutions for the challenges of patient-doctor fiduciary relationships and informed consent ethical dilemmas in handling COVID-19 patients. Next. And the benefits are, first, to give general and specific information about fiduciary relationship and dilemmas of ethic in informed consent. Second, give general description about the challenges of fiduciary relationship and the informed consent ethical dilemma in handling COVID-19 patients. And third, provide solutions for the challenges of patient-doctor fiduciary relationship and informed consent ethical dilemmas in handling COVID-19 patients. Next.
Okay, my name is Dewa Fony Prema Shanti, and I would like to explain fiduciary relationship. First of all, what is fiduciary relationship? Fiduciary relationship is a relationship that has complete confidence, trust, and reliance in someone who has a fiduciary obligation to act for the benefit of the individual. More simply, a fiduciary relationship is defined as a relationship based on trust. In medical field, fiduciary relationship is a very important condition, especially when it comes to the relationship between doctor and patient. The American Medical Association states the core fiduciary relationship between doctor and patient is the relationship for trustworthiness and help physicians to place the well-being of patient above their own personal interests and above obligation to other groups, and to advocate for the well-being of their patients. The doctor is obliged to use medical consideration with priority to the interests of the patient. Next.
Hello, my name is Dewi and I will explain about the informed consent. Informed consent is the way healthcare provider educates or gives an explanation to the patient about the benefits, risks, and alternatives of the procedure or intervention that will be given to them. The patient should know and be able to make a decision whether they will undergo the intervention or the procedure that given to them. Some of the required elements of the informed consent procedure are: first, the nature of the procedure; second, the benefits and also the rest of the procedure; third, reasonable alternatives that could be given; fourth, rest and benefits of the alternatives that could be given; fifth, the patient understanding of the element above. There are several issues of concern in the informed consent, such as: first, adequacy of informed consent. There are three acceptable approaches to adequate informed consent. They are subjective standard, reasonable patient standard, and reasonable physician standard. Second, exception in informed consent. There are several exceptions to informed consent, such as: the first, the incapability of the patient; the emergency which is life-threatening; the voluntarily waived consent. The next several issues in informed consents are children and informed consents, and the last is informed consent in blood transfusion. To obtain informed consent in medicine, there are processes that should be included. First, describing the purpose of the procedure or intervention, emphasizing the decision that will be made by the patient, discussing the alternatives that could be given for the intervention, discussing the rest of the intervention, and last is obtain the patient preference.
My name is Karina, and I will be explaining about the challenges of patient-doctor fiduciary relationship. American Medical Association principle of medical ethics stated the moral concept that physicians must act in the best interest of their patients' interest first above theirs. This statement described a Plato philosophical quote: "No physician considers his own good in what he prescribes, but the good of his patients." Physicians are obligated to have good relationship, known as patient-doctor fiduciary relationship, that extends beyond ethics in case of achieving solutions that recover the common good in healthcare. That is all from me. Thank you. Next.
I'm Raka, and I will explain you about challenges of patient-doctor fiduciary relationship. So, first, I would like to say physicians are the trustees of patients. By contrast, when physicians' trusteeship becomes separated from professional responsibility for patient care, either deniable matters of or challenge of trust happen for physicians. And based on study in Poland, societal awareness on trusting physicians and the medical profession was measured using Central and Eastern European countries' 5 scales of trust, or Likert scale, postulated that 3 out of 21 respondents were strongly agree about this. Supposing they are saying sometimes Dr. A care more about what is convenient for him or her than about my medical needs. And sometimes physicians care more about what is convenient for them than about their patients. So here is, physicians and even hospitals are not willing to keep their fiduciary relationship with patients because of their personal welfare. And another challenge in patient-doctor fiduciary relationship is a breach of sexual boundaries. The unscrupulous physicians often do sexual exploitation to patients that in such a trustworthy relationship, this may cause a bad impact on their mental well-being, such as depression, anger, trust issues, drug or alcohol intoxicated, and post-traumatic stress symptoms. Moreover, sexual exploitation includes sexual intercourse with patient, masturbating in the presence of the patients, genital contact, and rape or sodomy. These are similar in general population of survivors of sexual exploitation. Okay, that's all from me. Thank you. Next.
Winnie Chandra, and I'm going to explain about the informed consent ethical dilemmas. One of the ethical and legal requirements for actions involving humans is informed consent. Informed consent is a process where patients are provided with important information about a treatment to help them make decisions and voluntarily confirm their willingness after learning that treatment. Submitting informed consent is a must in Indonesia as stated in Law Number 29/2004, Article 45, paragraph 1. Doctors who perform medical procedures without the consent of the patient or their family can be sentenced to revocation of practice license as stated in Indonesia Health Minister Regulation number 585 year 1989, Article 13. Informed consent that well delivered can give some benefits, like increasing patient independence in making rational decisions, avoiding fraud and extortion, protecting patients, and increasing doctors' precision. That's why doctors must realize the importance of informed consent so doctors will not facing an ethical dilemma. Next.
Hello, my name is Sandy and I will explain the continuation for informed consent ethical dilemma. Ethical dilemma happen because of two or more contradictory ethical principles or a situation when someone must decide the best course of action. For example, patients that came with pregnancy but the baby is killing the patients. In this case, the doctors must decide the best treatment for her and the baby. Either giving birth to an earlier term or kill the baby, but killing is a crime. That's why doctors will facing an ethical dilemma. But in certain conditions, as stated in Indonesia Health Minister Regulation number 585 year 1989, Article 11, doctor doesn't violate ethical principles because informed consent is not required if the patient is unconscious or not accompanied by their family or the condition is emergency. Ethical dilemma can be avoided if doctor realize the importance of informed consent. Doctors must believe that well-delivered informed consent will increase patient trust and strengthen doctor-patient's relationship. However, there are six approaches that can be taken if facing an ethical dilemma. First, obtaining relevant facts. Second, determine ethical issues from facts. Third, determine who and how the person of group is affected by the dilemma. Fourth, determine alternative for solving the dilemma. Fifth, determine the possible consequence of each alternatives. And last, determine the appropriate course of action. That's all from me. Next.
My name is Williem, and I'm going to explain about relation of the fiduciary relationship and the ethical informed consent dilemma. Ethical informed originates from the legal compulsion and ethical obligation to the patient that has aimed to give information about medical condition, about their body, and from the ethical responsibility of the physician itself to make sure the involvement of patient in their own health. Sometimes physicians face ethical informed consent dilemma because of factors such as language barrier, religious influence, false explanation, children, patient perceptions, and vulnerable people and group. However, the relation between fiduciary relationship and ethical informed consent dilemma can also be seen from the patient's point of view, as occasionally the establishments of a fiduciary relationship make the patient give all responsibility to the doctor as they already fully trust the doctor. Therefore, they don't feel any informed consent is necessary. However, those factors shall be overcome as ethical informed consent dilemma is really fundamental in medicine and has a strong relation to the formations of fiduciary relationship, as it provides more clarity, granting more control and acquiescence, nurturing concordance with the patient's value, and preserve patient's behalf.
Hello, my name is Darren. During this time of pandemic, healthcare providers face different challenges in handling COVID-19 patients. They can no longer provide the usual ways of treatment as there are many new resources needed. Next. To ensure hygiene, healthcare providers need to have an adequate amount of hand sanitizers, tissues, face masks, and special rooms available in their clinics or hospitals. This special room is called the Airborne Infection Isolation Room, where patients exhibiting symptoms are isolated. Next. Healthcare providers will also wear extra protection, such as special types of face masks, hand gloves, isolation gowns, and eye protection, which takes quite some time to be put on completely and needs proper training to be mastered. Next. In addition to medical aspects, social aspects also pose as a great challenge. Many patients become dishonest about their travel history nor their health conditions, which may lead to greater risk. The feeling of distrust from patients may also stem from the fact that it is hard to build relationship with healthcare providers, as they are difficult to be recognized from all the equipment they are wearing. Healthcare providers are also often ostracized in society and are targets of aggressive behaviors from patients who are dissatisfied with the new protocols or procedures given. That's all from me. Thank you. Next.
Hello, my name is Adam. I would like to explain the solution for the challenge for of a patient-doctor fiduciary relationship and informed consent ethical dilemma in handling COVID-19 patient. Next, the pandemic period is related to medical personnel contracting the COVID-19 virus, which is caused by patient lack of openness in extracting information on the illness. There are several solutions that can be offered in COVID-19 patient related to challenge in the patient-doctor fiduciary relationship and the ethical dilemma of informed consent, namely sipakato communication. Next, what is the sipakato communication? Sipakato communication is a doctor way or strategy in making patients feel like comfortable when visiting a doctor. This communication aims to avoid mistake in diagnosing the patient disease, so doctors are expected to be able to control the communication process toward good interaction. Next, informed consent has become an interesting issue related to the COVID-19 pandemic. As a result, in addition to the therapy given by doctor being not optimal, the doctor is exposed to COVID-19 if it turns out the patient he's serving is a carrier of COVID-19. Therefore, the pattern of the communication between doctor and patient must also work together. That's all from me. Next.
My name is Mira, and I'm going to talk about Chapter 3. So from this student project, we can conclude that fiduciary relationship is a relationship that has complete confidence, trust, and reliance, and is largely influenced by the imbalance of knowledge between doctors and patients. Informed consent is the way healthcare provider educates or give an explanation to the patients about the benefits, risks, and alternatives of the procedure or intervention that will be given to them. And during the pandemic, there are different and new ways of treating COVID-19 patients, which becomes a challenge for healthcare providers and gives unfairness towards patients. Some patients convey dishonest information or cover part of the information. As a result, the therapy given by the doctor will not be optimal, and the doctor has a high chance of being exposed to the virus. One of the solutions that can be offered is sipakato communication, a doctor's way or strategy in making patients feel and comfortable when visiting a doctor. Well, that is all for me. Thank you very much. Next. So here are some references that we used to make our student project. Next. Well, that is all for our presentation. We apologize if we made any mistakes, and we close this presentation with Shanti. Santi.